Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudet. This is Idaho Matters. For 37 years, the Kids Count Date book has been measuring the state of kids, everything from how they're doing in things like math and reading to their economic well-being. And the latest Annie E. Casey Foundation report is out now. And Idaho's report card shows the state's children, well, they're falling behind in several categories, including reading, math, and children without health insurance. Ivy Walker is a policy associate with Idaho Voices for Children, and she's joining us live now to talk more about this. Ivy, welcome to the show. Nice to have you today.
Thank you so much for having me. I'm so excited to be chatting with you.
So, Ivy, tell us about Kids Count for folks who may not be familiar. It has been around a while, but give us an overview of what it looks at.
Absolutely. So as you mentioned, the Annie E. Casey Foundation puts out this Kids Count data book. It's a national report that tracks how children are doing in all 50 states. They look at key areas like health and education and economic security, anything that helps give us a clear picture of how child well-being is looking and where policymakers can make improvements.
So it's measuring states in categories and based on a score between 0 and 1,000. And it looks at overall child well-being. Now, Idaho got a score of 638. Can you walk us through what that score actually means?
Absolutely. This is the first year that the report has actually done a score. Normally, it has just been a ranking amongst states, but we realized that that wasn't painting a clear picture of just comparing how states are doing to each other. So to help track these trends better over time, they started incorporating these scores. So each category, there's 4 categories, so economic well-being, education, health, and family and community. Each of those has their own score, and then the average is taken for our total score of 638. But this year, Idaho ranked 13th in the nation for overall child well-being. Generally, I can say in the report, we went down in all the categories except for family and community. In fact, Idaho ranked 5th in the nation for our family and community factors.
So even though we ranked 5th for community factors, which is great, what does this year's ranking show in comparison to years past?
Sure. In years past, so we had a pretty high percentage of children living in poverty. And so between 2019 to 2024, those are the years that this report is looking at. We actually saw the share of children living in high poverty areas went down by 67%. We've seen the teen birth rate decrease, along with the rate of children living in single-parent households. We now are the second lowest in the country at 24%.
So what does that tell you since 2019 and the rankings today?
Yeah, I would say looking at this report as a whole, there are a lot of factors, and so there's a lot to unpack here. But what I would say is that this is looking at the long-term trends, and what's most important is what we do in response to this report. So the data helps us show where we can take action and where students are struggling the most. Particularly right now, it's the rate of uninsured children in the state. We saw a 60% increase during this time, along with 70% of Idaho's fourth grade students scoring below 70% in reading, along with eighth graders in math as well, scoring below proficient.
So I want to dig a little bit more into the education part of it because since 2019, Idaho's score has dropped 76%. So what does that tell you currently in regards to how kids are doing in reading and math?
I would say it's a really mixed picture. Like, we've made a lot of progress in reducing child poverty, but we're, like you mentioned, moving in the wrong direction on a lot of really critical issues. And these are all foundational to kids' long-term success. So what we're really seeing is that progress is uneven. So right now, Idaho has a lot of resources to do better, and this data is highlighting those clear opportunities for states to invest in programs that are proven to improve child health and well-being. And those solutions aren't a mystery. We know what works, and now it's about prioritizing those investments.
So you also looked at how many children here in Idaho are going to preschool. Talk to us about that.
Yeah, we are Idaho's one of the few states that doesn't, the state doesn't fund preschool. Many states do. What we are typically, I think, seeing with this trend specifically is that, well, there may be many factors going on, but I think overall kids are struggling academically, families are struggling economically, and families are having to make some really tough choices on what's most important.
So I want to talk now about the health score because Idaho's health score also dropped by 20%. So what does that mean for children? And you did mention health insurance, but walk us through this.
Yeah, even one child without access to healthcare is too many. 8% may seem small, but that represents thousands of Idaho kids who may not be getting the care that they need. And these checkups, developmental screenings, these are all long-term factors that are going to follow kids into adulthood. And it's especially important when we're talking about kids that this is Idaho's future, our future economy, our future workforce. And by not investing in kids now while they're young, while we can make significant strides to ensure that they are ready for school and ready for the workforce, when kids are getting these screenings and getting health care early, they are more likely to succeed and more likely able to recover and catch any disorders early on in life.
So you also took a look at child and teen death rates here in Idaho. Can you talk to us about those findings as well and what they tell you?
Well, there are many important indicators in the report, and they do all help paint a fuller picture of how kids are doing. But we are most focusing on the areas that lawmakers can take immediate action on, and that's really in the ensuring kids have access to health coverage, which could absolutely play into some of the child and teen death rates. But like many of these factors, there are a lot of different layers to each of these data points. But most importantly, I think that we would want people to walk away with today is that kids are really struggling in school, and we need to do proper investments into our public schools. And beyond that, also ensuring that kids have access to healthcare, so they're able to go and see a doctor. And so they're ready to go to school when the time comes.
So, as we mentioned, Idaho got an overall score of 638. Based on this year's report, what do you think are the biggest challenges for Idaho kids?
I would definitely say the health insurance piece is really big. I don't think a lot of folks really tie the importance of health insurance to a child's overall well-being. When we give kids healthcare access, especially when they're really young, that early childhood period is so critical. That's where a lot of their physical and cognitive and emotional development is happening. So when they have that consistent access to healthcare, that's setting a strong foundation for lifelong health and success. That would be, I would say, of the most consequence for kids. When they delay or forego care during this time, it can lead to really serious health problems and way higher costs over time. Missing these services in the early years will lead to more complex issues, and it undermines our efforts to ensure that kids are ready to succeed in school and beyond.
Well, I want to thank you so much for taking time to talk with us today. We've been speaking with Ivy Walker. She is a policy associate rather, with Idaho Voices for Children, and we've been discussing the 2026 Kids Count Data Book and how Idaho fared this year. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. If this podcast has become a part of your routine, can you tap 5 stars and leave us a review? It helps us stand out.
So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.